So let's talk the rest of the gram-negative bacteria, and these are very highly tested and very high yield topics. So we'll discuss Chlamydia species and also Gardnerella. So first one is Chlamydia. Chlamydia. So in the Chlamydia, first we discuss its general features. Chlamydia is gram-negative. So how it is gram-negative? Because it lack peptidoglycan due to the decreased production of muramic acid, which makes it gram-negative. And chlamydia is obligate intracellular pathogen. That's why it evades. It proliferates into the. It evades phagolysosome and causes a proliferation in the phagocytes. So it's gram-negative. So it causes mucosal infections, and present in two forms: elementary body and reticulate body. So E for elementary, R for reticulate. So elementary, then it is infectious or infectious. It is endocytosed into the cell, and it is small, dense, infectious, endocytosed into the. It entered into the cell, and there it transformed into reticulocyte. Transform into reticulate body. So reticulate body is a transformed elementary body, and R for reticulate, it replicates and it is reorganized. It replicates into the cytoplasm and via fission, and it reorganizes into cytoplasmic inclusion. This cytoplasmic inclusion is detected. This cytoplasmic inclusion is detected on Gemza stain or fluorescent antibodies stain. Also, we can do PCR and nucleic amplification test in order to detect chlamydia. Chlamydia has a different types. So first type A, B, and C. A means it is present on resources lack countries, especially Africa. It can causes blindness, especially the follicular cytoplasmic inclusion conjunctivitis in all the ages, neonates and adult, and it can causes chronic chlamydial infection, and also one of the causes for reactive arthritis. Then we have type D to type K species of chlamydia family. So they can causes everything, and they are very much important in the young people. It can cause urethritis, urinary tract infections in the youth. It can cause pelvic inflammatory disease. It can cause ectopic pregnancies. And when the female patient has infected birth canal, then it can cause neonatal conjunctivitis. There is also an additional information that it can cause the decay Its decay type can cause neonatal pneumonia and with scatocough and eosinophilia. Not very much testable, but it can also type DK can also causes pneumonia. Then we have type L, and this L type is very much tested, known as lymphogranuloma venereum, in which we have initially the patient has pain, less genital ulcers, and which resolve after few days. Then after few weeks the chlamydia reappears. Later on, a few weeks, they reappear as painful bubes, and we have known that bubes in the bubonic plague, we have discussed it, that bubes are the swollen regional lymph nodes, especially the inguinal lymph node, and these bubes have a specific complication that they ulcerate and causes discharges. So this is a painful bube which ulcerate. So this type is very much tested, and the type A is very much tested. Type D and K is tested in the reference of urethritis, pelvic inflammatory disease and ectopic pregnancy, and type ABC is very much tested in regard to conjunctivitis, and type L for genital ulcers. There is also two species, Chlamydia pneumophilia and Chlamydia psittaci. Psittaci is specifically in avian birds, parrot exposure, and both are spread by aerosolic and causes pneumonia. So how to treat chlamydia infection? So we treat chlamydia. First we give azithromycin, because there is no need to give no need to give peptidoglycan inhibitor like penicillin and ceftriaxone. So we directly give azithromycin or doxycycline, and if there is a non-gonorrheal dissemination like urethritis and pelvic inflammatory disease, then we add ceftriaxone in order to cope up that dissemination. So this is all about the chlamydia portion, and the next bacteria is Gardnerella. The next bacteria is Gardnerella vaginalis. Gardnerella vaginalis is pleomorphic gram-negative bacteria, and it is gram variable bacilli, and it is a particular anaerobe, and this anaerobe also releases amines. So if we take the sample of Gardnerella and we do amine whiff test, then this amine and this amine they have a cumulative effect. They add up and enhances the strong odor of the fishy odor of this amine. So what causes this so what are the diseases which are caused by Gardnerella? The Gardnerella causes bacterial vaginosis. Vaginosis means there is the bacterial growth, not an inflammation. So this is non-inflammatory overgrowth of an anaerobe. And how this overgrowth happen? So if a female, especially it is a vaginal condition, so if a female is having oral contraceptive pills, also she's a smoker and have a lot of sexual activity, and then does douching, then it disturb the vaginal flora, especially the lactobacilli, which maintain the acidic pH of the vagina in order to inhibit certain type of bacteria. So decrease in the lactobacilli, there is an increase or alkalinity in the vaginal vault, then and this environment overgrowth Gardnerella vaginalis, overgrowth Gardnerella vaginalis or overgrowth anaerobe. And the presentation is there is a thin grayish white discharge with the fishy odor, non-inflammatory, only discharge, and OCPs imbalance between OCPs can imbalance the bacterial flora. Smoking also does this. Sexual activity means if the person is involved in multiple activity or very frequent activity of sexual intercourse, then the semen, it disturbs the lactobacilli population. Also douching is a technique in which the female put a tampon filled with some kind of fluid like water, and they just put that tampon into the vaginal canal, vaginal vault, and release that fluid, and then wash out all the collected semen and other thing. So it just really washing all that process of washing the vaginal canal, vaginal vault, is known as douching. So these all disrupt the normal flora, vaginal flora, which is a lactobacilli, and these are the risk factor which can causes overgrowth of this anaerobe known as Gardnerella vaginalis, and the female feel that fishy odor specifically, and at that point she seeks medical attention. So there is a thin gray white discharge, and the physician take this discharge and do the amine whiff test. In this discharge mixes 10% KOH and evaluate if there is an enhancement of that odor or not. So if there is an enhancement, then then the physician do pap smear, and in the pap smear he saw, and the physician saw clue cells. Clue cells are actually vaginal epithelial cells, which are epithelial cells with overgrown Gardnerella vaginalis. And how to treat? There is a mention. I mentioned here specifically that this is not a sexually transmitted infection. So how to treat this? Just give macrolides or clindamycin in order to inhibit that bacteria or anaerobes. So this is the important bacteria, Gardnerella vaginalis and Chlamydia.